Well, this lecture is about the cranial nerves examination. Though all the cranial nerves examination is not very important from the point of view of a dental exam, but since we were discussing the cranial nerve exam, that's why I have discussed in this lecture about all the 12 cranial nerves and their respective clinical examination. Because it is better to remember more, and at least when we will go for the exam, we will be having idea about all the nerves a little bit about that instead of just remembering a little like studying a little bit less, and then even at the time of examination remembering even lesser than that. So let's start. Cranial nerve examination is a part of neurological clinical examination. Cranial nerve examination use the following sequence for the complete neurological examination. First of all, while discussing, while taking the history, while listening to their chief complaint, their mental status should be observed, and at least you will be in a position to uh, look into the mental status, if what kind of mental status they are. Is it sane? It is insane? Are they responding to your commands, verbal commands? Whatever they are talking, it is making some sense to you, comprehensive speech, etc., etc. Then perform the cranial nerves examination. Then motor system, sensory system, and reflexes. We are not going into the details of those systems in this lecture. Cranial nerve 1, the olfactory nerve. Though it is not tested routinely, test sense of smell in those who report loss of smell. Reason would be head trauma and abnormal mental status, and when presence of intracranial lesion is suspected. With person's eyes closed, occlude one nostril and present familiar aromatic substances, for example, coffee, orange, vanilla, soap, or peppermint, and ask them what they are smelling. Normally, person can identify an odor on each side of the nose, normally decreased with aging. Any asymmetry in the sense of smell is important. That is significant. Test the cranial nerves we are discussing now. The cranial nerve 2, which is optic nerve, test the visual acuity and visual fields by confrontation using ophthalmoscope. Examine the ocular fundus to determine the color, size, and the shape of the optic disc. Then comes the cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and the abducens nerves. We usually perform the test together for these three nerves. Palpebral fissures, usually they should be equal in width. Check the pupils for size, regularity, equality, direct and consensual light reaction and accommodation. Assess extraocular movements by cardinal positions of gaze. Nystagmus is back and forth oscillation of the eyes. So we are discussing about the cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. Assess the nystagmus carefully, noting presence of nystagmus in one or both the eyes. Pendular movement, the oscillations move equally left or right, or jerk a quick phase in one direction, then a slow phase in the other. Check about the amplitude, the degree of movement, fine, medium, or coarse, and the frequency constant, or it fades after a few beats. Plane of the movement, is it horizontal, is it vertical, rotary, or a combination of the movements? Then comes the trigeminal nerve. The motor function, it assesses muscles of mastication by palpating the temporal and masseter muscles as person clenches their teeth. We have discussed it in our previous lecture. Muscles should feel equally strong on both sides. Try to separate the jaws by pushing down on chin. Normally, you cannot do that. Sensory function with person's eyes closed, test light touch sensation by touching a cotton wisp to designated areas on person's face like forehead, cheeks, and the chin to check all the three divisions. Tests all three divisions of cranial nerve 5 like the ophthalmic, maxillary, and the mandibular divisions. Then comes the cranial nerve 6, corneal reflex. Omit the test unless person has abnormal facial sensation or abnormalities of facial movement. Remove any contact lenses if they are wearing. With person looking forward, bring wisp of cotton in from the side to minimize the defensive blinking and lightly touch the cornea, but don't touch the conjunctiva. Normally, person will blink bilaterally. Corneal reflex may be decreased or absent in those who have worn contact lenses. This procedure tests sensory efferent in cranial nerve 5 and motor efferent in cranial nerve 7. These are the muscles which close the eye as well. Then comes the facial nerve. The motor function, note mobility and facial symmetry as person responds to requests to smile, frown, close their eyes tightly against your attempt to open them, lift the eyebrows, show teeth. We have discussed about the different lesions which causes the Bell's palsy in our lecture on the cranial nerves as well. Have person puff cheeks, then press the puff cheek in to see the air escapes equally from both the sides. The sensory function, which is not tested routinely but test only when you suspect any facial nerve injury. When it is indicated, test sense of taste by applying cotton applicator covered with solution of sugar, salt, or lemon juice to tongue and ask the person to identify these tastes in the anterior two-third of the tongue, not on the posterior one-third. Then we are discussing about the cranial nerves. So now we will be discussing about the cranial nerve 8, which is vestibulocochlear nerve, acoustic nerve. We use the tuning fork to test the hearing or any hearing impairment of the person, to check the auditory part of the vestibulocochlear nerve. Well, cranial nerves 9 and 10, glossopharyngeal and the vagus nerves. Motor function, they depress the tongue with, like you have to depress the tongue with the tongue blade and note pharyngeal movement as person says ah or yawns. Uvula and soft palate should rise in midline and tonsillar pillars should move medially. Check out any asymmetry in the movement of uvula. Well, touch posteriorly pharyngeal wall with tongue blade and note the gag reflex. Voice should sound smooth but not strained. Sensory function, cranial nerve 9 does mediate taste on posterior one-third of tongue, but technically it is very difficult to test. Then comes the cranial nerve 11, the spinal accessory nerve. Examine sternomastoid and trapezius muscles for equal size. Check equal strength by asking person to rotate their head against resistance, which is applied to the side of the chin. Ask person to shrug their shoulders against resistance. These movements should feel equally strong on both the sides. Then comes the cranial nerve 12, hypoglossal nerve. Inspect the tongue. No wasting or tremors should be present when the person is bringing the tongue outside or saying ah. Note forward thrust in midline as person protrudes. Check out when they thrust the tongue forward, there is no any deflection on either side. The tongue will deflect towards the weaker side. So ask the person to say light, tight, dynamite, and note that the lingual speech is good. That is for the letters of L, T, D, and N. It is clear and distinct. So over here, we are done with our today's lectures.